Welcome back to Blissful Broadcast. A huge thank you to all my amazing subscribers for your continuous support. If you're new to the channel, we welcome you. Hit that subscribe button and turn on notifications so you don't miss out on future videos. Today we're diving into a serious topic: 10 early warning signs of lung cancer. We'll be discussing 10 early signs that you should never ignore. Early detection is key when it comes to fighting any cancer, and lung cancer is no exception. Recognizing these signs and getting diagnosed early significantly increases the chances of successful treatment and recovery. So let's get right to it. Remember, this video is for informational purposes only and not intended to substitute professional medical advice. Let's start with a symptom many of us experience: a cough. It's our body's way of clearing airways, but a persistent cough lasting more than 8 weeks could be a red flag, especially if it lingers after a cold or flu. Pollution or allergies can play a role, but it's better to err on the side of caution. If accompanied by other symptoms, get it checked out. Coughing up blood, even a small amount, is alarming. This is called hemoptysis, and it's never normal. Blood and sputum could indicate lung cancer. Schedule an appointment with your doctor. Early detection is key for successful treatment. Let's delve deeper into the alarming symptom of coughing up blood, also known as hemoptysis. This is a sign that should never be ignored, no matter how small the amount of blood may seem. Even a trace of blood in your sputum warrants immediate medical attention. Coughing up blood can indicate a range of issues, from relatively minor conditions like bronchitis to more serious concerns like lung cancer. The color of the blood can sometimes provide clues, but it's not a definitive diagnostic tool. Bright red blood might suggest a fresher bleed, while darker brownish blood could indicate an older bleed. Regardless of the color, any instance of hemoptysis requires prompt medical evaluation. Your doctor will likely perform a physical exam, inquire about your medical history, and order tests to determine the underlying cause. Remember, early detection is crucial, especially when it comes to lung cancer. Ignoring hemoptysis could delay diagnosis and potentially reduce the effectiveness of treatment. Let's talk about another common symptom of lung cancer: shortness of breath, also known as dyspnea. We all experience shortness of breath from time to time, especially after strenuous activity. But when breathing becomes a struggle, even during simple tasks like walking short distances or climbing stairs, it's time to pay attention. Lung cancer can cause shortness of breath in several ways. As a tumor grows, it can obstruct the airways, making it difficult for air to flow freely in and out of the lungs. Additionally, fluid can build up around the lungs, further compressing them and making breathing a challenge. If you find yourself gasping for air more frequently than usual, even during activities you could easily handle before, don't ignore it. Make an appointment with your doctor to discuss your symptoms. They can assess your lung function, review your medical history, and determine if further investigation is needed. Addressing shortness of breath promptly can lead to timely diagnosis and treatment, potentially improving outcomes for individuals with lung cancer. Chest pain is a symptom that often sends people rushing to the emergency room, and for good reason. It can be a sign of various conditions ranging from heart problems to muscle strains. But did you know that lung cancer can also manifest as chest pain? When a tumor grows in the lungs, it can press on surrounding tissues, nerves, and blood vessels, leading to pain. This pain can be sharp or dull, constant or intermittent, and may worsen with deep breaths, coughing, or laughing. The characteristics of the pain can provide clues about its underlying cause. For instance, chest pain associated with lung cancer is often described as a persistent ache or pressure in the chest, which may radiate to the back, shoulder, or arm. If you experience persistent or worsening chest pain, especially if it's accompanied by other symptoms like coughing, shortness of breath, or unexplained weight loss, it's crucial to seek medical attention promptly. Early detection is key to effectively managing any health condition, including lung cancer. Have you noticed a significant drop in your weight without changing your diet or exercise? Unintended weight loss can be a red flag for health issues, including lung cancer. Known as cachexia, it's common in various cancers. It happens when the body breaks down muscle and fat for energy. Tumors release substances that interfere with metabolism. If you lose 10 pounds or more suddenly, consult your doctor. Early detection improves treatment outcomes and survival chances. Loss of appetite, also known as anorexia, is another concerning symptom that can be associated with lung cancer. It's more than just skipping a meal or two, it's a persistent disinterest in food, often accompanied by feelings of fullness even after eating very little. Lung cancer can affect appetite in several ways. The tumor itself can release hormones that suppress hunger signals, leading to a decreased desire to eat. Additionally, cancer treatments like chemotherapy and radiation therapy can often cause nausea and vomiting, further contributing to appetite loss. If you're experiencing a significant and persistent loss of appetite, it's essential to pay attention to your body's signals. It's important to consult your doctor if you notice any drastic changes in your appetite. Early detection and treatment of any underlying conditions, including lung cancer, can significantly improve outcomes. Our voice is a powerful tool for communication, and any changes in its quality can be concerning. Hoarseness, a raspy or strained voice, is a common symptom of various conditions, including laryngitis or overuse of the vocal cords. However, persistent hoarseness, especially if it's not related to a cold or flu, could be a sign of something more serious like lung cancer. Lung cancer can affect the voice when a tumor grows near or presses on the recurrent laryngeal nerve, which controls the muscles that move the vocal cords. If you experience hoarseness that lasts for more than 2 weeks, especially if it's accompanied by other symptoms like a persistent cough, shortness of breath, or difficulty swallowing, it's crucial to consult your doctor. While hoarseness can be caused by various factors, including acid reflux or thyroid problems, it's essential to rule out any serious underlying conditions like lung cancer. Early detection and treatment are crucial for improving outcomes and preserving vocal cord function. We all experience fatigue from time to time, especially after a long day or a poor night's sleep. But cancer-related fatigue is different. It's a persistent and overwhelming exhaustion that doesn't improve with rest. Lung cancer can cause fatigue in several ways. The tumor itself can release substances that disrupt your body's natural energy production. Additionally, cancer treatments like chemotherapy and radiation therapy can often lead to fatigue as a side effect. If you're experiencing fatigue that's persistent, severe, and interferes with your daily activities, it's important to talk to your doctor. Early detection and treatment of lung cancer can improve outcomes and potentially reduce the severity of fatigue. Our immune system is constantly working to protect us from harmful invaders like bacteria and viruses. But when lung cancer is present, it can weaken the immune system, making it easier to develop infections, especially respiratory infections like bronchitis and pneumonia. Lung cancer can obstruct airways, creating an environment where bacteria and viruses can thrive. If you find yourself experiencing frequent or recurring respiratory infections, especially if you have other risk factors for lung cancer like smoking, it's essential to consult your doctor. Preventing and managing infections in individuals with lung cancer is crucial for improving their quality of life and overall prognosis. This may involve vaccinations, prompt treatment of infections, and lifestyle modifications to reduce exposure to germs. Swelling in the neck and face, while seemingly unrelated to lung cancer, can actually be a sign of a serious complication called superior vena cava syndrome, SVCS. The superior vena cava is a large vein that carries blood from the head, neck, arms, and upper chest back to the heart. Lung cancer can sometimes cause SVCS when a tumor grows near or presses on the superior vena cava, obstructing blood flow. This obstruction can lead to a buildup of fluid in the tissues of the face, neck, arms, and upper chest, resulting in swelling. If you experience sudden swelling in the neck and face, especially if it's accompanied by shortness of breath, difficulty swallowing, or a bluish discoloration of the skin, seek immediate medical attention. Treatment for SVCS typically involves addressing the underlying cause, which in this case is lung cancer. And there you have it, the 10 early signs of lung cancer you should never ignore. Remember, early detection is crucial for successful treatment. If you're experiencing any of these symptoms, please don't hesitate to consult a medical professional. I hope this video has been helpful in raising awareness about lung cancer and empowering you to take charge of your health. Please share this video with your friends and loved ones and comment below and tell us how your health journey has been. We would really love to hear from you. Thank you for joining me today, and as always, stay happy, healthy, and blessed.